Migraine Triggers in the Modern World, How Screen Time, Poultry, and Diet Shape Brain Health. Introduction. Migraines are more than just headaches. They are a neurological condition that affects millions of people worldwide, often causing debilitating pain, nausea, visual disturbances, and extreme sensitivity to light and sound. While the root causes of migraines are still not fully understood, recent studies are helping shed light on how modern habits, especially those tied to technology and nutrition, can influence migraine frequency and intensity. A new study from Taiyuan Central Hospital in China has revealed a significant link between excessive smartphone use and increased migraine risk. The study also explored dietary factors, uncovering that high poultry consumption may be associated with higher migraine incidence, while other foods like coffee and oily fish were linked to a reduced risk. This article explores the science behind these associations and offers gentle, practical strategies to help reduce migraine triggers and support long-term brain health. The smartphone migraine connection, what the study found. The Chinese study included participants who reported frequent smartphone usage alongside migraine symptoms. The researchers found that individuals with high daily smartphone exposure had a significantly higher risk of developing migraines. The proposed mechanisms include screen-induced light sensitivity. Prolonged exposure to bright screens, especially in dim environments, can overstimulate the optic nerve and exacerbate neurological activity linked to migraine onset. Postural strain. Leaning over smartphones for extended periods can increase muscular tension in the neck and shoulders, leading to tension-type headaches that may progress into migraines. Sleep disruption. Smartphone overuse, particularly before bed, has been shown to delay melatonin release and worsen sleep quality, another major contributor to migraine frequency. This research aligns with a prior Turkish study that linked excessive smartphone use to poor sleep quality and increased daytime fatigue, both of which are known migraine triggers. Dietary factors, surprising links to poultry and brain health. In the same study, dietary habits were analyzed alongside smartphone use. Researchers identified an unexpected association. Frequent poultry consumption appeared to correlate with a higher incidence of migraines. While the mechanism remains under investigation, one hypothesis suggests that poultry, especially processed or commercially raised varieties, may contain high levels of omega-6 fatty acids, histamines, and additives like monosodium glutamate, MSG, which have been shown in previous studies to trigger or exacerbate migraines in sensitive individuals. On the other hand, the study found that certain foods may help protect against migraines, including oily fish like tuna, mackerel, and salmon, which are rich in omega-3 fatty acids, known to reduce inflammation and support neurological stability. Coffee, when consumed in moderation, was associated with a lower risk. Caffeine can constrict dilated blood vessels in the brain, potentially relieving migraine symptoms when used appropriately. However, abrupt withdrawal or overuse can also trigger headaches in some individuals. Understanding migraine triggers, an individualized approach. Migraine triggers vary widely from person to person, but researchers and clinicians agree that tracking patterns and avoiding common irritants can significantly reduce flare-ups. Some of the most common triggers include bright lights and screen glare, dehydration, skipping meals or fasting, hormonal changes, especially in women, strong odors and loud noises, sleep disturbances, certain food additives or preservatives. Maintaining a headache diary, even for a short period, can help individuals identify consistent patterns and support informed decisions about environment, diet, and routine. Supportive lifestyle strategies for migraine management. While there's no universal cure for migraines, proactive lifestyle choices can significantly reduce their impact. These include reducing screen brightness and using blue light filters on smartphones, tablets, and computers. Improving posture during screen use, keeping the neck aligned, shoulders relaxed, and taking frequent breaks. Practicing consistent sleep hygiene, going to bed at the same time each night, and avoiding screens at least 1 hour before sleep. Staying well hydrated throughout the day, as dehydration is a common migraine trigger. Incorporating anti-inflammatory foods like leafy greens, berries, seeds, nuts, and fatty fish while reducing processed and high-sodium meats. Engaging in regular movement, such as walking, yoga, or gentle stretching, to reduce tension and support blood flow to the brain. When to seek help. For many, migraines can be managed with lifestyle adjustments and over-the-counter remedies. However, individuals experiencing frequent, severe, or disabling migraines should consult a healthcare provider. New prescription treatments, ranging from triptans to CGRP inhibitors, are offering relief to many who do not respond to traditional therapies. Furthermore, integrative therapies such as biofeedback, acupuncture, magnesium supplementation, and mindfulness-based stress reduction may offer additional support for those seeking a holistic path to migraine care. Conclusion. This new research adds to a growing body of evidence that our daily choices, particularly around screen time and diet, have a powerful impact on neurological health. By understanding the links between smartphone use, poultry consumption, and migraines, we gain practical tools to support ourselves or loved ones in managing this painful condition. Small changes like dimming your screen, adding more omega-3 rich foods, and getting restful sleep can make a significant difference. As always, tuning into your body's signals and respecting its needs remains one of the most effective ways to cultivate long-term wellness and serenity, especially when facing the challenges of modern life.